I'm Dr. Elizabeth Batista, and I'll be going over pneumonia briefly today. So just giving a brief overview as far as what pneumonia is. So pneumonia is an infection in the lungs caused by either a virus or a bacteria. And typical symptoms usually include fever, cough, usually with phlegm, so you're coughing up something yellowish, greenish, shortness of breath, so difficulty breathing, sometimes chest pain, and usually, or like what we use to evaluate patients that we're concerned for having pneumonia, we do, as always, a medical history to really get a sense of what your symptoms have been, how long you've been having those symptoms, and then do a physical exam. Especially a lung exam is especially important just because we're able to kind of get a sense, is air coming in and out very easily? Is there areas where maybe there's like some sorts of infection where you can kind of like get in air in and out very well? And aside from that, vital signs, which are like the first things you do whenever you go to either a clinic or a hospital setting. So the physical exam, like I mentioned, is kind of like one of the best ways to be able to get a sense if you do have a pneumonia. But the X-ray, which getting an actual image of what your lungs look like, will actually be able to help us localize to see exactly where a pneumonia is and how kind of extensive it is, if it does in fact exist. We could do a nasal swab at this point. I'm sure all of us are very aware of what the nasal swab involves and how uncomfortable they can be. But this is mostly just to get a sense of like, could it be a virus like COVID, flu, RSV, and then blood work just to see if there's any signs of infection, inflammation. And lastly would be urine test. So there's some pneumonias that are caused by bacteria that actually we can test through the urine. So this is not as common as like a blood test or the nasal swab, but it's something that we can do to test for specific organisms. And then lastly, as far as treatment, so I'm sure at this point, most of us are aware of like hydration, the importance of hydration. Where we're not feeling well, it's okay that we don't have an appetite, but the most important thing is to hydrate, taking as much fluids as we can. The worry is always about becoming dehydrated. And then there are medications to help with fever, and also aside from fever, for pain, discomfort whenever you're battling an infection. And then there would be antibiotics. This would only be against bacterial infections. And then respiratory support. So sometimes, if you do in fact have a pneumonia, sometimes patients need oxygen, sometimes they need a little bit more higher oxygen support, but that does vary with like how severe the pneumonia actually is. And here I just put kind of this graphic here to kind of explain a few things. So as far as like how a pneumonia is spread, how are these infections spread from person to person? And at this point, we've been accustomed to like masking during COVID. We've gotten used to the fact like having a mask on just helps preventing like those respiratory droplets, as we refer to them as. So as when we're coughing, there's kind of these droplets that are leaving our mouths. When we sneeze, there's those droplets, and that's how these infections are spread. And this is why we always emphasize the importance of hygiene, be it like washing your hands, be like sneezing in like the inside of your elbow, just to kind of avoid having those droplets get everywhere. So here we're getting down and we see like the lungs, and we have like the these areas are called the bronchioles. So just kind of like the smaller airways. So on the left top here, we see what a normal bronchiole looks, just like those smaller airways, and we see the air sacs. They're nice and clear. Air is able to come in and out really easily. Now, when we have pneumonia, an infection in the lungs, what happens is like these like smaller airway spaces become filled with some fluid, with bacteria, and this is what makes it difficult to breathe. And this is what we're listening for when you're examining your lungs. There's places where we can't hear the air coming in and out very well when we're asking you to take a deep breath, and that's because there's something kind of like clogging that area. And that's what the X-ray is able to pick up as well. Individuals that are higher risk of developing pneumonia. I mean, all of us can develop a pneumonia, but there's certain individuals that because of certain health conditions, because of their age, they're just at a higher risk of actually developing it. So individuals that are older than 65, as we get older, where everyone is at a higher risk of getting any sort of infection, especially pneumonia. Cigarette smokers. You can imagine that smoking cigarettes does affect your lungs, especially if you're smoking for a long period of time, kind of breaks down the lung tissue in a way that makes you more prone to getting infections. Underlying lung disease. If you have asthma, chronic obstructive pulmonary disease, or COPD, you're just at a higher risk of getting any sort of infection that's directly affecting the lungs. If you have a weakened immune system because of an underlying health condition, because you're on medications like steroids that do have their benefits for certain medical conditions, but they do weaken our immune system if we take them for long periods of time. If there's individuals that have difficulty coughing due to stroke and kind of being able to like get rid of like that phlegm and like that stuff that needs to be released because if it kind of just just it's in your body, it's kind of prone to developing into an infection. And then lastly here, if you had a recent viral upper respiratory tract infection where you have coughing, runny nose, the kind of the highest risk of developing another infection is if you already have one to begin with.
Are children at high risk of pneumonia, or is that more something that you see in older adults, like young children?
So children are at risk as well. There's also like levels to it. Like if you have a child with like a chronic underlying medical condition, they're of course at a higher risk. But there's kids that kind of have no medical history, they kind of been well, and then they can also develop a pneumonia. And like I mentioned, a lot of the times it's because they have an underlying respiratory infection. It could be a virus, they could have the flu, and then they can also develop a bacterial pneumonia on top of that.
What is the difference between pneumonia and walking pneumonia? What is walking pneumonia?
So, I mean, it's still pneumonia. The difference is
Yeah.
like the walking pneumonia, it's because walking pneumonia is just kind of coined, it's caused by a specific organism, Mycoplasma pneumonia. They call it walking pneumonia because you can really just kind of be walking around looking well and then just have like this
Mm,
really bad cough. You might have not like really high fevers. So it's kind of like a pneumonia where you're not like stuck in bed, where you're having like
gotcha.
104-degree fevers, but it's still a pneumonia that still needs to be treated with antibiotics. Not like I think stereotypical, we think of like, oh, you're either like in the hospital because you need
Mhm.
IV antibiotics or you're home not able to get out of bed, where the walking pneumonia caused by one specific organism is just like you still have pneumonia. You don't feel as bad.
Is walking pneumonia contagious? If you're mobile and out in the world, should you be masking because it's contagious?
Absolutely. Yeah. Just like with every
Okay.
infection, those respiratory droplets, when you're coughing, when you're sneezing,
Yeah.
all those droplets are going everywhere. So masking isn't definitely important, like hand hygiene. We're always around other people and touching different objects. And the only way to kind of avoid, there's really no other way to go about it, is to just hand hygiene and masking. Just a list of vaccines that help with pneumonia prevention. So there's a wide variety of them, and a lot of them we actually get as children, and some that we still, continue getting as we get older, as far as like the pneumococcal vaccine, the flu vaccine, which should get yearly, the RSV vaccine, which is more relatively new and now available for both adults and children, the COVID vaccines. Here we have the H flu, pertussis, measles. The last are usually we get as children, and we might need to get boosters as we get older. That like childhood period is really important to kind of get all those important vaccines early on. And here I just kind of gave a little bit more information as far as each vaccine. So breaking it down, for the first one's for the pneumococcal. So this vaccine targets specific bacteria, the pneumococcus, that causes the most common type of bacterial pneumonia. And this is usually given to adults older than 65. Children start getting these vaccines when they're 2 months, which again, just try to get them protected early on when they don't really have a strong immune system. The flu vaccine, again, something for both adults and kids. The RSV vaccine, also for adults, we're aiming for greater than 60 years old and newborns. And then the H flu, this is one I mentioned you usually get as a child, as well as pertussis and measles, and for which we can also get boosters if needed. Just going over a little bit over the different vaccines, is like I think a lot of the times maybe we're wondering why, like how does the flu vaccine help against the pneumonia? How does the RSV vaccine help? Because maybe in our minds it's easier to make the association, like the pneumococcal, the one that's like sounds like pneumonia would help against pneumonia, but how do these other vaccines help? So pneumonia can be caused by either a virus or a bacteria, and they can be serious either if it's a virus or a bacteria. The only difference between a virus and bacteria is that for bacterial pneumonia or for any sort of bacterial infection, we have to treat it with antibiotics. You don't treat viruses with antibiotics because they just won't be affected by them. So flu, so as mentioned, I think earlier, the question about the child, there was a child in the hospital who had the flu and then developed a pneumonia on top of that. And that's just something that's commonly seen. So again, if we're preventing kind of like that first infection, we're definitely making the case that we're not allowing it to progress into something more serious. Because again, it affects everyone very differently. Sometimes someone can get the flu and have no symptoms at all. Sometimes someone can have like a runny nose, cough, just like body aches. And sometimes someone can have it to the point where like they need to go to the hospital because they need IV fluids. They just need closer monitoring. So these vaccines are really helpful because what we're trying to do is prevent. We're not sure like who can get what infection, like viral or bacterial, but the important thing is that we're trying to prevent these from ever occurring so that we don't have to get to the point where we're needing to treat. Who should get those vaccines? So adults, as again I mentioned, like older than 65, adults over the age of 18 with any of these chronic conditions. So I've been smoking for a long period of time. You're of course affecting your lung tissue. That's going to put you at a higher risk of being able to like develop an infection in the lungs. And also, as I mentioned, like the asthma, COPD, diabetes, alcohol use disorder, if there's any issues with the liver, kidney disease, you can see like a common theme is these are like chronic health conditions. So if you're anyone that's been dealing with a health condition for a long period of time, most likely you're going to fall under this list, and it's just better to be protected with the vaccines. And my next slide, I dive in just in a little bit into more like the types of the pneumococcal vaccines because there are different types. And as mentioned, like we get these as children as well, and these do vary depending on our age. The pneumococcal vaccine, it protects against pneumococcus, which is the most common cause of bacterial pneumonia. And there's two different types. There's the PPSV23, which protects against 23 types of pneumococci. This is effective in adults. It's not really cleared for any infants or children under 2 years old. So really don't see this until like later on in life. And then the second type would be the PCV. So the PCV20 is what we give children, again, between like a 2, 4, 6 months when they're getting all their vaccines to set them up for childhood. And we also have the PCV13 and PCV15. So the specific vaccine that you will need will depend on what you've gotten in the past and on your medical conditions. But just knowing that there's different types, I think is important because you might talk to someone and someone might say they have gotten this vaccine and you might get a different one, and just like understanding that there's different vaccines depending on your age and your health conditions. So prevention, aside from the vaccines, which I think I've touched a good amount on already, would be making those like lifestyle changes that would help get you to be living like a healthier lifestyle. So I mentioned like smoking, it puts you at higher risk. So avoiding smoking, trying to figure out ways for smoking cessation, hygiene, that would go into like living a healthier lifestyle, which would be like improving your diet, exercise, kind of the things that we can control. And then of course, aside from that, controlling your underlying medical conditions, making sure that you're up to date on your like routine exams, that you're getting your blood work regularly as needed, and that you're taking the medications that you need for the certain conditions. Here, I just kind of give a little bit of breakdown of what vaccines, so the ones that we've talked about, the pneumococcal flu, RSV, COVID, avoiding the smoking, just because you kind of weaken your resistance to pneumonia by causing that damage to the lungs. Hygiene, as we touched, like making sure like hand washing with soap or using an alcohol-based sanitizer, masking, and then trying to live a healthier lifestyle and controlling those underlying medical conditions. I work at Settlement Health Clinic, which is located on 106th Street between 2nd and 3rd Avenue. I work under, we're the medicine pediatrics provider. So you probably realized that I spoke about working with children. So we do see both adults and children. And we work under our kind of supervisor, Dr. Joseph Trulio. So if anyone wants to kind of establish care in a different clinic, I think it would be helpful just to like say if you want to see specifically under MedPeds, under Dr. Trulio, to try to get an appointment. I listed the phone number there, and I have my business card, which kind of just gives that information a little.
If you have bacterial pneumonia, is it something, I mean, that would resolve itself without antibiotics, or antibiotics are necessary for it to be resolved?
Like anytime you have any sort of bacterial infection, it's really hard, especially like when it's somewhere like the lungs. Like there's nothing really coming out to be able to like clear that. Like the lung has things that are able to like get things out of it. But what makes it difficult with like any sort of lung infection is just things kind of just like stay stuck there. And so that's why antibiotics are kind of really the standard of care. I really can't say that without antibiotics that you'll be able to get clear from a bacterial pneumonia, because the bacteria, unless something is fighting against them, is just going to continue growing. And what we always worry about, it's spreading. And that's kind of like why we give the antibiotics very early on. Aside from just like getting rid of the infection that already exists, we want to also prevent that from spreading elsewhere, especially into the blood, and can cause you to be septic and other issues. So definitely antibiotics if there's clear bacterial pneumonia. And there's like, of course, like pneumonia, you can have pneumonia and you can just like take pills by mouth, but then can get to the point where you need antibiotics.
Where else can pneumonia spread? You mentioned the blood. I mean, can it spread anywhere? I mean, like, could it sort of spread to the infection spread to any other part of the body, or is it sort of particular areas that you look for other than the blood?
I think the blood would be like the first place. And that kind of, because if something spreads to the blood, then it can go anywhere, right? Because blood is circulating all throughout your body. So that's the most common secondary infections are usually a bloodstream infection. And then if you have that, you can have an infection pretty much anywhere.